I welcome you all to today's session. Myself Rajita, and in this session we are going to discuss regarding a very important and interesting topic of the introduction part of the medical surgical nursing. Now, whenever as a nurse you are going to a clinical setup, we should definitely know regarding our roles and responsibilities and what are the etiquettes we should maintain in a hospital setup in order to provide a proper health care to the patient, right? So, in this session of today's, we are going to learn regarding the role and responsibility of our nurses in a OPD. Now, what does this OPD stands for? It basically stands for outpatient department. So, first, let us learn here what you mean by outpatient department. Followed by that, we will be discussing what are the basic roles and responsibilities of a nurse is having in a outpatient department. So OPD or outpatient department is basically defined as a particular department in the hospital setup with allotted physical and medical facilities with medical and allied health science staffs. Now, this outpatient department will be regulating or will be operating at a regular scheduled hour within the day, which will be generally providing the medical care to those patients who doesn't require a hospital admission or a continuous health monitoring and checkup or a overnight stay in a healthcare facility. So I hope by this definition of outpatient department, you got the idea that it is a particular department facilitated in a hospital setup which will be having their own physical, medical, and staff facility provided. And it will be operating in a particular hour within the day, which will be generally providing the care to those patients who doesn't require a continuous treatment or admission to the hospital setup in order to get the medical care. So, for example, as suppose a person have got a fever, right, or she is not feeling or she is not having any other complaint or health issues. So, generally, what we do as a general population, they will be asking or they will be seeking the medical care in an outpatient department. Now, this kind of patient doesn't require a hospital admission. They neither require a continuous monitoring. Rather than they just require a treatment or a basic treatment which will be helping them to get cured. So outpatient department will be definitely doing this particular work. Now, you might be asking, as we have learned about the operation of outpatient department, what are the benefits of this outpatient department services are included? So here we are going to learn regarding some benefits of outpatient department in clinical setting. So the first benefit of outpatient department is it is a very cost effective method to provide the adequate treatment to the patient because it doesn't require a hospital stay, it doesn't require a staff to continuously monitoring the patient or providing the care to the patient. In this particular setup of outpatient, a person will come seek the medical treatment or consult with a medical officer and will be getting a proper medical care and will be leaving the hospital setup. That is the reason it is a very cost effective method in order to provide the care to those who are not very chronically or severely ill. The next benefit of outpatient department is it needs a short hospital stay. So generally what we see is on outpatient department, there will be provided with a particular duration of time in which the patient should come and seek the medical treatment or consult with the medical officer. So definitely the stay within the hospital is very less here. The third benefit of outpatient department is it is a less time consuming method or procedure to provide medical care for both of the parties, like for the patient as well as for the medical officers and other healthcare staff. So here we are not spending much time on a particular patient in order to provide them medical care. We are providing medical care as per the need of the patient, but with a very less and constrictive and short time. So that is the reason outpatient department is considered to be one of the most important department, which is having a very less time consumption, but it will be providing a very effective medical care to those patients who need it. Now, the next benefit of it is considered that a well equipped and a well constructed outpatient department will be definitely reducing the load of a patient in an inpatient department. So, as you are getting the information that the basic treatment will be done for the patient in an outpatient department only. Now, if the outpatient department is very organized and equipped, so most of the medical care or the treatment would be provided there, which doesn't require a hospital stay from the patient. That is how it will be ultimately reducing the load of the patient in an inpatient department. So only from outpatient department, those patients will be referred to the inpatient department who actually in need of a continuous medical care and monitoring. That is how a well organized outpatient department will be definitely helps to provide the care in a cost effective manner. It will be also ensuring that it is a less time consuming way to provide the medical care to the patient, as well as it will be reducing the load of patient in inpatient department. So the next benefit of outpatient department, definitely it is a main part of the organization or a healthcare setup where basically the preventive and promotive healthcare activities would be done effectively. So most of the client who are approaching to outpatient department, sometimes they will be approaching even for a proper health checkup or for a regular health checkup or a follow-up. That is the reason why outpatient department is a particular and exact location where the medical staff can perform preventive and promotive activities of health, which will be ultimately increasing the quality of life in general population. So definitely we can say a well organized outpatient department also will be helping to promote or to improve the quality of life of general population. Now, the next benefit also we can consider that OPD or outpatient department is considered to be the base of the healthcare facility. So it is the basic where the people or the general population is usually approached to get the proper or adequate medical care. Now, the next and last but the most important point or benefits of outpatient department is it definitely helps a person to seek medical care without the interruption of their social, personal, or professional life. So many of the disease condition which actually requires a continuous treatment. Now, if a person is coming to OPD, they won't be having any interruption to their professional or personal life or to the social life. So majority of the client will be happily coming to the outpatient department and seeking the medical care. But in case of other department like where a patient needs to get admitted to the hospital, definitely because of the hospital stay, it is going to affect the person's life, like social life, professional and personal life. But here in case of OPD, that doesn't need an interruption in the social, professional and a personal life of a patient. So that is a very great benefit of outpatient department within a hospital setup. So I hope till here we have learned regarding the different benefits of outpatient department within a hospital. Now, let us move on to the next topic, which is basically we will be discussing here regarding the objective of outpatient department. So, what we are going to basically do here in the outpatient department. So, the first objective of outpatient department is to provide an adequate and quality of medical care. So basically in outpatient department, adequate and high quality of medical care would be provided to the patient who are seeking it. So also the next objective of outpatient department is to use all the modern techniques and equipments and to provide a high quality medical care to the patient, as well as to reduce the hospital stay of the client who are seeking the medical care. So it is one of the most important objective of outpatient department, which is targeting to reduce the workload or reduce the patient load in the inpatient department, which is basically is a very cost effective method in respect to a patient as well as society. The next objective is to maintain a well-versed public relation. So as I said that outpatient department is considered to the base of the healthcare facility. So through this, a well-versed public relation can be maintained with a hospital from a hospital or with the general population, which will be ultimately helping to provide adequate medical care in order to promote and prevent health disorders. The next objective is the OPD have objective to create a facility in a cost effective manner and in a time saving way. So those two method is very effective in order to provide adequate and high quality medical care to the patient. So outpatient department has a next objective to provide a effective curative, promotive and preventive treatment in order to manage the disease condition. The next part is to make treatment very easily available. Now, this is a very important point what need to be discussed, that sometimes many of people or many of the person will be very concerned regarding the hospital stay, because as I mentioned, it is definitely needs a huge amount of money. So due to that, many persons would not be seeking medical care even if they are in need. But OPD or outpatient department, as it is a cost effective method to provide the medical care, so it is definitely have an objective to make the medical care easily available to all the person living in a particular society. Now, the next objective is the concept of outpatient department should be more approachable to the client. So that is how we have learned all the specific objectives of outpatient department. So next we are going to move on to the next topic related to the outpatient department, that is the function of outpatient department. What are the function will be going on in this particular department? Let us study here. So first, it will be providing a major source of specialist medical care. Also, it will be helping for the early diagnosis, curative, promotive, preventive treatment to the patient. The next function of outpatient department includes screening the patient and also helps them for the admission to the hospital setup or to a healthcare facility if there is any need. So screening inside the outpatient department plays a very important role, as I have mentioned before, because it decides whether a person need a continuous monitoring, to be very honest, whether a person needs a hospital stay or whether the person can have the medical care and can leave the hospital. So that is how screening of the patient here plays a very important role. The next function of outpatient department includes to improve the follow-up care and provide a proper and adequate care after even the discharge of the patient. So once a patient has a long stay in the hospital, maybe now he or she is not in a need to have a continuous monitoring. So once they're getting discharged from the hospital setup, basically the outpatient department helps the client to get or to seek the care after discharge, even to maintain a proper follow-up for the client who needs it. So the next function of OPD, it also helps a healthcare staff to provide adequate health education to the people who are approaching to the outpatient department, maybe for a follow-up or maybe for a regular health checkup in order to promote their health. So outpatient department provides a very good facility to promote the health education and promote the health of every individual residing in a particular society. The next function of outpatient department includes is rendering of the preventive health care. So through the outpatient department, preventive health care would be provided to those clients who are comes under risk of development of some health issues. So that is how outpatient department plays a very important role in order to provide a preventive, promotive, curative and rehabilitative medical care to all the person who are seeking it in a healthcare facility in a time consuming or in a less time consuming and in a cost effective manner. So as we have learned till here regarding the function, objective and what is outpatient department is, now we are going to learn regarding different types of outpatient department. So let us start with the first type of outpatient department, that is named as general outpatient department, which is basically located within a hospital. Now, how does the general outpatient department works? We'll study here. Now, generally we call the general outpatient department as where no patient is coming who needs emergency medical care or who needs emergency medical treatment. Now, these are the areas where people will be coming for the consultation to the physician or to the medical officer. Generally, the people will be coming here for doing the regular follow-up or to seeking the adequate care after the discharge, or maybe who needs a regular health checkup. So here in general outpatient department, we do not see generally any emergent cases of the patient. Now the next type of outpatient department is named as emergency outpatient department. So in emergency outpatient department, generally those patients will come who needs a very urgent medical care and treatment, but maybe they're not in a need to have a continuous hospital stay. So the cases can be a real emergency or can be a perceived emergency. Based on that, on an emergency outpatient department, medical care and treatment will be provided to the patient. If there is any indication, maybe the patient will be suggesting to go for inpatient department for a hospital stay and for continuous health monitoring. If there is no need, the person will be getting discharged from emergency outpatient department itself. So that is how the emergency outpatient department and general outpatient department plays a very important role to screen the patient and to send them or suggest them for the further treatment procedure or need of the stay or in the healthcare facility. The next type of outpatient department generally we see or we call it as the referred outpatient department. So these are the location of specialist medical care will be provided to the patient. Now suppose from general outpatient department, a person has screened with certain signs and symptoms which is indicating that the person may have developed some problem with the neurological system of them. So they will be referred to a specialist or specialized outpatient department which will be generally dealing with a particular patient who are suffering from neurological disorder or diseases. That is how the referred outpatient department will be the specific and specialized outpatient department which will be dealing the cases of a particular disease or of a particular system. So as we have learned the first category of outpatient department, where we have seen three categories. First, we have learned regarding general outpatient department. Next, we have learned about the emergency outpatient department, and after that, we have learned about the department or outpatient department, which would be generally called as referred outpatient department. So as we have learned regarding this, now we are going to learn about the next classification of outpatient department, and this classification would be definitely done on the basis of the services which is provided from outpatient department. So the first category here is named as the centralized outpatient department. So here we are going to learn how the centralized outpatient services or departments will be working. So generally in centralized outpatient department, all the services will be provided in a compact area. Here, the diagnostic and therapeutic activities will be going on in hand. So basically, we are going to see altogether there will be facilities for diagnosis, facilities for therapeutic approaches of the medical care too in a specific compact area. Now, this kind of outpatient department, we are referring it as a centralized outpatient department, or the services which are provided by this outpatient department are termed as centralized outpatient services. Now, decentralized outpatient department is the second category of outpatient department. Here, generally, we are going to see services will be provided to the patient who needs the medical care in respective area. Now, these are the outpatient department which are very specific and which will be dealing with certain specific disease condition only. So, for example, gynecological outpatient department. These are the areas where only the gynec patient will be dealt with. The next one is orthopedic outpatient department. In this kind of outpatient department, only the client will be accepted who is suffering from or developed with some orthopedic disorders or diseases. So that is how some specialized areas of the outpatient department, if it is present in a healthcare facility, we are going to call that particular outpatient department or services as decentralized outpatient department and services. Now, as we have learned regarding how the OPD or outpatient department will be working, we have also learned regarding the types of outpatient department. So I definitely am sure that you have got a clear picture regarding outpatient department and how it is going to work. Now, I will be giving you an idea regarding the responsibilities of a nurse which they're having while dealing the patient in an outpatient department. It is a very important point to you to know regarding the role and responsibilities in the outpatient department, because once you are going to deal with the patient in outpatient basis, these are the roles that has to be kept on mind. So here we are going to learn regarding the responsibilities. The first and the most important responsibility of a nurse within outpatient department includes, so the professional responsibility definitely includes providing effective care to the patient as well as to maintain effective teamwork. So basically here in within an outpatient department, a nurse is expected to maintain a very solid communication within the healthcare team who are providing the healthcare to or medical care to the patient, right? And she is also responsible to maintain a effective care providing to the patient. So here, that is how the nurse should maintain a professional responsibility within an outpatient department. Next, we're going to learn regarding the clinical responsibilities of a nurse within our outpatient department. So it is a very important role of a nurse to maintain or to monitor the clinical policies, procedures, procedure, whatever is going to performed on the patient, as well as the standards and protocol. So he or she might be maintaining all the standardized protocol within the outpatient department. So basically, it is a nurse's role to maintain the quality standard of outpatient department and to provide a very effective medical care to the patient in order to manage their diseases and also to prevent and promote their health and diseases. The next responsibility is related to the administration. So as we know, nurses also plays a very important role as administrator within a healthcare setup. So simultaneously in our outpatient department also, nurses are going to perform a very important administrator's role. Basically, they will be maintaining an optimum level of care for the patient, and also it is their role to allocate the staff properly wherever it is required, and maintaining the resources also plays a very important role here of a nurse within the outpatient department. The next responsibility is to adhere to the hospital policies and procedures and protocols, as I have mentioned before. So it is definitely role of a nurse to maintain their standardized protocol that is formed by each one of the hospital, through which the nurses will be maintaining the legalized area, or also will be helping to have the client a clear picture of their procedure of medical care, what they are going to accept. Now, the next role and responsibilities of a nurse to maintain a healthy and safety environment. So it is a very important role of a nurse to maintain their safety and also to maintain a very healthy environment in order to promote their health, as well as to prevent any disease condition among the patient who are seeking medical care. Now, the risk management is the next most important role and responsibilities of a nurse within our outpatient department. So, reporting to all the clinical and non-clinical accidents, incidents, even near misses promptly to the supervisor or in charges are definitely would be done by each one of the nurses who are present in our outpatient department. Remember, it is a very important part of a nurse to maintain all the record and data regarding the patient and regarding the procedures that would be done for the patient in order to manage the condition. Even the accidents, incidents, and near misses also should be promptly and clearly communicated to the person who are responsible for the supervising of the work of the outpatient department. That is how all the legal issues and the safety of healthcare professionals as well as the patient would be ensured by a nurse. The next role or a responsibility of a nurse is to maintain the confidentiality. So definitely many of the people will be coming to seek the medical care. Now it is a nurse's role to maintain the confidentiality of their report and records for each one of the client. The next role is the infection control. So as the OPD or outpatient department is an area where maximum communication with the healthcare staff and general population will occur. So it is a very important role of a nurse to maintain the environment infection free so that the infection control can take place and no spreading of infection will occur further. So that is also one of the major and most important role of a nurse within the outpatient department. The next role is safeguarding the vulnerables. So often we are going to see the vulnerables will be approaching to the healthcare facilities, basically to the outpatient department. Here, vulnerables means definitely indicating the age group or basically the older age group, the age group under who are considered under as children. They are to be safe. Even the pregnant women are also considered to be come under vulnerable group. So safeguarding those patient or safeguarding those population or vulnerable population, here it's a very important role of a nurse to maintain within the outpatient department. Now, as we have learned regarding the basic responsibility and role of a nurse, here we are going to learn some more roles which will be directly related to the patient care. So, the first role here will be definitely the direct care or the client care. So, history collection, physical examination would be often done by a nurse. Here, nurses plays a very important role to perform a thorough history collection and physical examination, and also it is a nurse's role to assess all the data, maintain the confidentiality of the data, and they also will be initiate the early treatment plan and medical care which has to be provided to the patient in order to manage them. So it is basically a nurse's role to ensure effective client care within the hospital. So the next important role of a nurse is the client advocacy. So here nurses plays a very important role, which will be basically considering the patient as their first priority. So all the nurse working in different setup definitely will be caring, or definitely will be prioritizing the patient and their need as the maximum and major priority. So it is a nurse's role to help them or to advocate from the patient side regarding their interest, and also it is a nurse's role to maintain the dignity of each and every person or patient who are seeking medical care and who are approaching to the outpatient department. Now also nurses here plays a very important role to help the client to involve in the treatment plan. So definitely from the nurses or from the patient side, nurses will be the one who will be advocating their need, their interest, and their preferability regarding the medical care or treatment plan. So, as a patient advocate, it is also a nurse's role to communicate all other healthcare worker within the healthcare setup where a person is or where a client is approaching for seeking the medical care. So, it is also a very important role of a nurse to maintain the advocacy role within the outpatient department. So the next role of a nurse is to maintain the documentation or charting each and every incident and accident or all the procedures that would be performed to our outpatient department. So they must record their findings, the data that has been collected from the patient, their physical examination related data, the procedure that has been planned, implemented, and intervened. All the data should be documented or charted by your nurse, mainly within the outpatient department. It also helps to manage many legal issues in case of any healthcare professionals or in case of patient. It also helps to manage the data management and all the effective method of treatment, and will be also helping to get enough information related to the patient care and medical treatment which will be intervened for the patient to manage the emergent situation or the disease condition. So that is how documentation or the charting is a very important role of a nurse within the outpatient department. The next role of a nurse is into the client education. So as I have mentioned, outpatient department provide the facility to promote the health education in order to promote the health and prevent the diseases. So here nurses plays a very important role by providing enough client education regarding their health and regarding their lifestyle and the medical care and treatment whatever has been planned for them. It is also helps a nurse to counsel the patient and to make sure that the patient is maintaining a proper and regular follow-up or doing or performing a regular health checkup, as well as to continue the care after discharging from a healthcare facility. That is how within our outpatient department, nurses also plays a very important role in client education. So generally the nurses would be educating the client and their family member regarding the health, the illness, the factors that are affecting or the probable factors which are affecting, the probable risk factors which are present for the client, as well as the treatment procedure, whatever has been planned for them. Even the rationale behind the treatment planning also would be described or discussed with the client and family member. It is also a very important role of a nurse to involve the patient and the family member in the treatment procedure or treatment planning within the outpatient department. The next role and responsibility of a nurse is definitely the communication. So, communication plays a very important role within the outpatient department because this is the area where screening of the patient would be done and suggestion would be provided whether the client needs a hospital stay or not, or the further investigation or diagnostic procedures and treatment plan. So, nurses here plays a very important role in communicating the planned treatment or whatever the rationale is present behind the treatment plan to the family members as well to the patient itself. As well as here nurses also will be helping to communicating within the health care team. So that is how a nurse definitely will be helping to improve the quality of medical care which would be provided to a patient within our outpatient department. So I hope till here we have learned regarding the major roles and responsibilities of a nurse which will be played by them within our outpatient department. Now you have to remember it is a very important topic because as we are going to learn regarding further topics of medical surgical nursing, we will be seeing that and if we are approaching to a clinical setup, we will be seeing that the patient are approaching to the outpatient department in order to seek medical care. By learning the role and responsibilities of a nurse, we would be definitely helps to improve the quality care that is offered by a hospital setup or by the outpatient department to the client. Also, here we can improve the treatment procedure or the quality of the treatment procedure for the client, as well as we can promote the health of a particular individual. Also, we can prevent the disease condition by maintaining all the role and responsibility. So I hope you have enjoyed the session and also you understood the topic. So I hope you guys have enjoyed the session very much and you got the concept of this topic of role and responsibilities of a nurse in an outpatient department. So we'll meet you guys in the next session. Thank you for attending this one.